Okay, good morning, everybody. Thank you for having me here today. Today I will be sharing with you more about wisdom teeth, which is a common problem that has affected most people. I shall be covering these points in my talk today: causes and prevalence of impacted wisdom teeth, problems associated with impacted wisdom teeth, management options and procedures, and risk associated with removal of wisdom teeth. And finally, some recommendations from the point of view of oral health professional. So firstly, what are wisdom teeth? Contrary to what their name suggests, wisdom teeth have nothing to do with wisdom at all. The wisdom tooth actually refers to the third molar, which is the last tooth in each quadrant of the dental arch. Wisdom teeth may not always be present, meaning that it is possible for some people to not have any wisdom teeth at all. However, for those people who do have wisdom teeth, these teeth usually start to emerge from the gums between 17 to 25 years of age and may be associated with pain and gum swelling as they erupt. Because they erupt at a much older age compared to the rest of the dentition, hence the name wisdom teeth. Very often, wisdom teeth may be impacted, meaning that instead of growing straight, they grow at an angle such that their path of eruption is blocked. As such, they become trapped and thus are unable to erupt properly into a functional position. This happens largely due to crowding or lack of space within the dental arch. These teeth may be partially erupted, with only part of the crown of the tooth visible of the gums, such as in this picture here, or completely unerupted, meaning that the tooth totally cannot be seen in the mouth, but instead is completely buried underneath the gums. The prevalence of impacted third molars has been found to range from 9.5% to 68% in different populations, and lower third molars are more commonly impacted than upper third molars. So is it going to be a problem if you have one or more impacted wisdom teeth? Well, impacted wisdom teeth have the potential to cause a variety of issues arising from difficulty maintaining good oral hygiene, leading to presence of a persistent food trap, given that it is close to impossible to floss the area between the impacted wisdom tooth and the adjacent tooth. This can lead to dental caries, also known as tooth decay, gum disease, and infection. So I'll explain more about these problems in greater detail later on. Cyst formation, although it is relatively rare, is also a known problem associated with impacted teeth. So dental caries, this is a very common problem, due to inability to cleanly remove any residual food or plaque that gets stuck between the wisdom tooth and the adjacent tooth. So this can cause decay, not just of the wisdom tooth, but also the adjacent tooth. As you can see in the radiograph here, the arrow is pointing to the decay present on the adjacent tooth. Besides building up between the wisdom tooth and the adjacent tooth, plaque can also accumulate easily underneath the gum flap that covers the wisdom tooth, again due to difficulty cleaning underneath this gum flap. As such, pericoronitis, which is inflammation of the gums overlying the wisdom tooth, may occur, as seen in the photo here, where the gums become red, swollen, and tender. In severe cases, pericoronitis can also result in swelling of the face and neck when infection tracks from the area around the wisdom teeth into the neighboring spaces of the neck. And this can be potentially life-threatening when the swelling affects the airway. With persistent bacterial infection, resorption of the bone between the wisdom tooth and the adjacent tooth can occur. So here you can see the bone level marked out in red on the X-ray. Notice how much lower it is compared to those around the other teeth, which is marked out here in yellow. So the loss of supporting bone can eventually result in increased mobility and loss of the adjacent tooth. Cyst formation around impacted teeth is also a rare possibility with approximately 1% chance of occurring. So a jaw cyst is like a bubble or a sac that develops within the jawbone and can enlarge in size over time. Cysts are usually benign, but they can get infected and cause pain and swelling. So this radiograph here shows a cyst marked out by the yellow arrow, which has developed around the lower left wisdom tooth. By the time it was discovered, it had already grown to quite a substantial size, as you can see here. Once a cyst has developed around a wisdom tooth, the tooth will need to be removed together with the cyst. So given that impacted wisdom teeth tend to cause problems as mentioned earlier, what should we do to manage these teeth? So these are some options for management of impacted wisdom teeth, which I will go through in greater detail. So the first very obvious option, of course, would be surgical excision of the wisdom tooth, which basically refers to surgical removal. And this is a minor surgical procedure that involves making a small cut over the gums that's covering the tooth. We may need to remove some bone that is covering the tooth, and we may also need to cut the tooth into smaller pieces to be removed piece by piece. Thereafter, the wound will be sutured. This procedure can be done under local anesthesia or general anesthesia. So this is just a brief mention about the LA versus the GA options. Basically, anesthesia means loss of sensation. So local anesthesia is actually achieved by numbing up the area to be operated on with a few injections into the gum area. There is hence no pain during the surgery, but the patient will remain completely conscious throughout the whole procedure. LE is generally well tolerated by most patients, especially if they are only removing 1 or 2 teeth and the removal process is relatively short and uncomplicated. However, for patients with wisdom teeth that are associated with pathology, such as jaw cysts, or for deeply buried teeth, or simply for patients who are afraid of undergoing dental procedures and would very much rather be asleep, general anesthesia is also a feasible option for removal of this. Post-operatively, these are some of the common things to expect. So soreness of the wound area may last for a few days to a week, depending on the individual. Painkillers will be prescribed to be taken after the surgery. These are generally effective most of the time for pain control. Oozing of blood is also expected and should usually stop on its own within 24 hours. Swelling of the face usually occurs due to the body's inflammatory response to surgery and will generally subside over 1 week. Bruising over the cheek area that spreads to the neck may also occur, especially in fair-skinned patients, due to accumulation of blood within the tissues that shows up externally, and this is not a cause for concern. Some patients may feel that they are unable to open their mouth as widely as before the surgery, or they may have pain at the jaw joints. All this is temporary and is due to the force applied to the lower jaw during the surgery, as well as the extended duration of the surgery, which causes fatigue of the lower jaw. Bear in mind, of course, that every wisdom tooth and every patient is different, and there may still be additional specific instructions that your attending dentist may advise you of. But in general, after surgery, we usually encourage our patients to go on a soft diet for 1 week and to bite firmly on a piece of gauze placed over the tooth socket if bleeding is encountered. Patients should also avoid spitting and rinsing vigorously, as this may dislodge the blood clot within the socket and result in worsening of the bleeding. For patients with swelling of the cheek, ice packs placed over the swollen area can help with reducing the swelling. Patients should also avoid doing strenuous exercise for 1 week. So every surgery comes with risk. I'm now going to explain to you more about the risks associated with wisdom tooth removal. These are some of the more general risks, such as damage to the adjacent tooth, and also where there is pre-existing bone loss already around the adjacent tooth, the tooth may become mobile, or the root surface facing the wisdom tooth socket may become exposed, leading to sensitivity of the adjacent tooth post-op. Wound infection and excessive bleeding from the wound are also some standard risks associated with any surgical procedure. Now moving on to the risk associated with removal of lower wisdom teeth. So there are 2 nerves that run in close proximity to the lower wisdom teeth. One of them, known as the inferior alveolar nerve, supplies sensation to the lower lip and the chin, and the other nerve, which is the lingual nerve, supplies sensation to the tongue. So because of their proximity, there is a small possibility of injury to these nerves during the removal of the lower wisdom tooth, which may result in permanent numbness of these affected areas. Numbness of the tongue may also be associated with loss of taste sensation. Fracture of the jawbone is a very rare risk. This may occur either if excessive force is applied during the surgery or if the tooth is so deeply impacted that the remaining jawbone around the tooth becomes very thin and susceptible to crack. As for specific risk for removal of an upper wisdom tooth, so the sinuses are located just above the roots of the upper molars. In some patients, the upper molar roots may extend into the sinuses, or for some, there is only a thin layer of bone between the roots of the teeth and the sinuses above. For such patients, there is a possibility of breaching this natural layer of bone between the base of the tooth socket and the sinuses above during removal of an upper wisdom tooth, especially if this tooth is deeply buried in close proximity to the sinus floor. Once there is a breach like this, there will be an unnatural direct communication between the mouth and the sinus above, and this may actually result in infection of the sinus, which is otherwise known as sinusitis. Okay, now let's move on to our next alternative treatment option. So this is only for very mildly impacted wisdom teeth, where most of the tooth surface is already exposed. Operculectomy is a possible treatment option. So the operculum is a term that we use to describe the gum flap that is covering a partially erupted wisdom tooth. And operculectomy hence refers to removal of this gum flap alone without having to remove the tooth. However, there are only a very small select number of cases that are amenable to this approach. And even so, there is a risk of regrowth of the operculum after the procedure. Okay, then for impacted wisdom teeth that have not caused any pain or issues yet, or for those that are riskier to remove, leaving alone is also an option. However, it is very important to bear in mind that these wisdom teeth may still have the potential to cause problems like what we mentioned earlier on. And so it is recommended to do yearly monitoring with a dental radiograph and clinical examination in order to detect and treat any problems in a timely manner. Now, remember I mentioned earlier that not all wisdom teeth are impacted. So what do we do for these non-impacted wisdom teeth? For example, the radiograph on the left side shows a non-functional upper wisdom tooth. We call it non-functional because it is not in contact with any opposing tooth and hence does not contribute to chewing function. Such teeth can be removed or left alone depending on the patient's preference. If left alone, these teeth generally do not cause significant problems if maintained well, although there is a tendency for such teeth to over-erupt into the space below, since there is no opposing tooth to stop it. So in this radiograph, you can see, in fact, that this non-functional tooth has already over-erupted, and it is appearing longer than the rest of the teeth next to it. Besides non-functional wisdom teeth, there are also functional wisdom teeth. So functional wisdom teeth means that they are able to come into contact with the opposing tooth when chewing. For example, in the radiograph on the right side, the upper and lower wisdom teeth are able to contact each other during function. So in such cases, there is actually no indication for removal of these teeth if they are healthy, as they are basically an additional unit of teeth to bite with. In conclusion, these are some recommendations. So regular dental checkups with your general dental practitioner with appropriate radiographic examination are helpful in early detection of impacted wisdom teeth and problems associated with them. The management options available and the risk and benefits of each option should be thoroughly discussed. For complex cases of wisdom teeth removal, such as those that are deeply impacted in close proximity to vital structures, such as the inferior alveolar nerve or the maxillary sinus floor, or those that are associated with jaw pathology, such as cysts or tumors, referral to an oral and maxillofacial specialist is warranted. These are the credits, and that is the end. Thank you.